Powerful words today, both inside and outside the Ohio Statehouse, as Ohioans battle over bills that affect millions. Thanks for joining us today at 5:30. I'm Yolanda Harris.
And I'm Andrew Kinsey. We've been following several controversial bills making their way through Ohio's legislature. These bills addressing gender-affirming surgery for young trans people, access to abortion, and the teaching of controversial concepts in the classroom. Today, lawmakers address the first two bills on your screen there. 10 TV's Brittany Bailey is live at the State House where testimony for one of these bills wrapped up this afternoon. Brittany.
Well, Andrew, House Bill 454 has certainly stirred up a lot of emotions, and both sides actually agree on one thing, that this is a life or death matter for young transgender people in our state. The difference is whether they believe this bill will save them from harm or cause it.
When a person gets to be 18 and as an adult, make up your own mind, live how you want to. That's okay. But when you are a minor, you don't understand these things.
That's the essence of why House Rep Gary Click says Ohio needs House Bill 454. It would ban gender-affirming care for minors who are transgender. The procedures would not be covered by insurance or Medicaid, and those who do provide that care would be penalized. And school nurses, counselors, and teachers would be banned from withholding a student's gender identity concerns from parents. It's something that affects a mere fraction of Americans, and gender-affirming care is strongly supported by the American Academy of Pediatrics.
Say the adulting for adults and let kids be kids.
But this is against the majority medical opinion, and you're not a doctor yourself, so why do you...
Doctors are in there. They're testifying.
Who did not treat children.
Oh, so that's irrelevant. They understand the medicine, they understand the science. Why did they not treat the children? Because it's unethical.
Thursday's hearing was a chance to hear from supporters of the bill.
And I am here out of a grave concern for those teenage girls seeking these procedures, because I know, based on personal experience as a member of the trans community and the emerging testimonies of detransitioners like myself, that there are unique needs going completely unaddressed in this cohort.
We hope that this bill will encourage hospitals to help parents untie the knots of gender identity confusion and get to the bottom of why our children believe they are transgender, which is the negative label.
I think it's insane to just delegate care to the child. It's irresponsible and it's dangerous, and I think the state has a responsibility in helping parents out in this.
It is not your place.
But just outside the hearing room,
I can hear them. I'm right by the window.
We are being as loud as we can to try and overshadow the people who are trying to gaslight our community, spew ignorance and intolerance.
this small group was determined to be heard.
I have a duty to childhood me to do the work and protect this generation and pave a way so that they can grow up without trauma.
Now, State Rep Beth Liston did release a statement after the hearing saying today's hearing brought in out-of-state hate groups with an extreme agenda to bully our kids. Vulnerable children in Ohio should have the freedom to access evidence-based health care and should not be used as pawns by politicians. Now, there will be more hearings on House Bill 454 in the future, including one where opponents can be heard. Of course, we'll be covering that for you. For now, reporting live outside the State House tonight, Brittany Bailey, 10 TV News.